this time, we will have a moment of silence honoring the memory of former County Manager Vance Gullidge and former Finance Director Dorothy Tassel. They both retired from County Government some years back.
And Chairman, if I could, I want to add, dear friend, Mr. Luke Ratliff, Brian's son on that brief.
Yes, ma'am. I wrote this in. Cameron Luke Ratliff, and he had a nickname, Fluffopotamus. And if you've noticed, if you've seen the news, he's actually been in the news since it happened, because he was at University of Alabama, and he was one of their biggest fans. And he's been following them religiously. But he passed away, I believe it was yesterday.
No, he passed away last Thursday.
Last week, okay, I'm sorry. Okay, and this time we will have a moment of silence honoring the memory of these individuals. Thank you. And Mr. Ratliff is an Anson County native. Didn't mention that. Okay, at this point, before we approve the agenda, I will read the State Government's Ethics Act, General Statute 138A. It is the duty of every board member to avoid both conflicts of interest and appearances of conflict. Does any board member have any non-conflict of interest or appearance of conflict with respect to any matter coming before the board? If so, please identify the conflict and refrain from an undue participation in a particular matter involved. Does anyone have any conflicts? Okay, at this time, the approval of the agenda by commissioners. Before we do that, does anyone have anything to add? I'll go down to commissioner concerns, petition announcements, and comments. Yes, sir, Mr. Monroe.
Yes, sir. For the consent agenda, there are 4 budget amendments that we would like to add. First one is the Article J. It is for ACTS, Road Funding, ROAP, Rural Operating Assistance Program.
Okay.
Next one, K.
Okay.
Also ACTS funding, DOT reimbursement. The next one, also ACTS, CARES Direct Funds, CARES Direct Funding. That was L, I apologize, that was L. And then M, the last one, is about a bid bond that we had kept from our corporate partners in the past, and we want to return that to our partners. So it is M, DSS bid bond.
Okay.
That's all I have to add.
Tell me what L was, please.
L was ACTS CARES Direct Funding.
Okay.
Yes, ma'am.
Commissioner concerns EMS unit and more.
Anyone else?
I have one other concerns considering trash and litter.
Trash and litter. Okay. Anyone else? I'll add an ordinance for gaming. I think it's probably something we need to look at. Yes, that'd be HC ordinance. For gaming establishments.
I think you did on.
Okay, if there's not any, okay.
Could we also have an update on the status of the 3-day dumping sites for the landfill?
Okay. Anyone else? Okay, all right, at this time, we need to approve the agenda with the additions.
So moved.
Second. Motion by Dr. Sims, seconded by Commissioner Gatewood to approve the agenda with the additions. All in favor, let it be known by saying aye.
Aye.
Opposed, like sign. Okay, motion carries, it is unanimous. The agenda is approved. Okay, consent agenda. We've got 2A, which is the minutes, 2B, property tax refunds and adjustments. Then we've got several budget amendments. The first one is the Health Department, CDC COVID-19 vaccination program, the Emergency Management, HMAP grant, which is a hazardous materials emergency preparedness. DSS, LIEAP, which is Low Income Energy Assistance Program, that's grant 1 and 2, that's E and F. DSS, CIP grant, Crisis Intervention Program. Then H and I, which are budget amendments for the teacher supplemental fund balance and teacher supplemental supplement Article 46 sales tax.
I have a quick question. What does LIEAP stand for?
Low Income Energy Assistance Program, that's
Okay,
DSS.
got it.
Get wood for people during the winter.
I got it.
Okay, and we just covered the ones with the county manager, that's J, K, L, and M. Okay, so we need a motion now to approve the consent agenda.
I make a
I'll
motion.
make a motion to approve the consent agenda.
Second, okay.
Okay, motion by Commissioner Gatewood, seconded by Commissioner Sturtevant and Commissioner Sims to approve the consent agenda. All in favor, let it be known by saying aye.
Aye.
Opposed, like sign. Okay, motion carries unanimously, the consent agenda is approved. Do we have any public addresses?
No, sir, we do not.
Okay. That brings us down to item 4, appearances. Dr. Thompson, COVID-19 update.
Thank you, Mr. Chairman. Good evening, good to see everybody. I'm joined this evening by our nursing supervisor, Dana Thomas, our preparedness coordinator, Elon Burr. And before I begin my formal report, this is National Public Health Week. And if there was ever a time to celebrate the public health workforce, it is right now. And I want to, for the record and publicly, say to you how much I appreciate, as I know you all do, the work of the public health workforce, particularly since last March, about 13, 14 months ago. They have worked and continue to work tirelessly, sometimes up to the point of exhaustion, and particularly before Christmas, before vaccines became available, really every day they were putting themselves at risk in order to protect the health and safety of the people of Anson County. And I could not be more proud of each and every one of them. I'm going to start with an update on cases and vaccinations, and then a couple other things that are going on, and then we'd be happy to answer your questions. Relative to the total number of cases, it's pretty much all good news. As we're seeing across the country and in the state of North Carolina, our cases over the last month have continued to trend down. As of today, we're at 2,434 total cases, only 20 of which are active. And to put that in perspective, we've had 135 new cases since I was here in March. If you go back from January to February, we had 510 new cases. Then it was almost half of that from February to March, 242. And it's almost half of that again between March and April, where we're down to 135 new cases. With only 20 active cases. Today, for example, we only have one new case. And I'm hopeful that between now and when we're here in May, that we will be able to report we had at least a few days with no new cases. So that's where we're at on the cases. Relative to vaccinations, I would say Anson County is doing well. So far, if you look at the county as a whole, about 5,700 people, or about 23% of the population, has received at least the first dose.
I think your organization has just been outstanding.
And about 16%, about 4,000 people are fully vaccinated at this point. Many, some of you in this room. Of that total, the health department has administered about 70% of that amount. And we're proud of that. Around 3,900 total doses, first doses. As of today, we are opening the COVID vaccinations. You probably saw this in the all users email I sent out this morning. We're open to all adults 18 and over. While it's true that about 23% of the population in Anson County has got at least the first dose, if you break that down, it's much higher in our older at-risk population, you know, the 65 and over, over 50 with multiple chronic medical conditions. And what we're seeing now across the state, nationally, is that a lot of the, I think nationally 75% of the 65 and over have been fully vaccinated. If you look in Anson County, our 2 long-term care facilities, our assisted living facilities, virtually all the residents have been vaccinated. And what we're seeing across the country now is that younger, healthier people, college-age students, are making up the bulk of the new cases because so much of the older population has been vaccinated now. Like Governor Cooper announced, we are opening COVID vaccinations effective really today to all adults 18 and over. I've had some questions. The state has announced that people 16 and 17 are eligible, and that's true. And I would encourage people 16 and 17 who want the vaccine to get it. Of the 3 vaccines that are approved for emergency use authorization, the Pfizer vaccine, the Moderna, and now the Johnson & Johnson, only the Pfizer vaccine is authorized for 16 and 17-year-old. And because of the ultra-cold temperature storage requirements, minimum shipment of 775 doses, which is way too much for us, our health department has not been allocated any of the Pfizer vaccine, and I do not think that we will ever be. We have been allocated the Moderna vaccine, which comes in shipments of 100, which is about right for us. So people that are 16 and 17 can go online to the Find My Spot, Get Your Shot website and you can check Pfizer and pull up all the sites that are offering the Pfizer vaccine, and they could go get that vaccine. One of the trends that we have seen over the last month, as the number of cases have come down, and as we're heading into spring and towards summer, and as we've gotten more and more of the older age cohorts vaccinated, we have seen a pretty significant decline in the demand for the vaccine. So, starting next Monday, next week, we will vaccinate on Tuesdays and Thursdays out at EMS base in Country Club Road, as we have been. We will have capacity for about 220 per day, Tuesday and Thursday. That would be 110 first doses and 110 second doses. One of the other reasons that we decided to move in that direction is we have not been seeing patients and having our normal clinical services provided since Christmas time. And we really need to start seeing patients in the office at the health department again. So starting next week, we'll be going back to our normal, albeit with masks and etc., in-person clinical services Monday, Wednesdays, and Fridays. We'll be vaccinating on Tuesdays and Thursdays. Another reason that we're doing this, there are more and more vaccine sites available. All of the Walgreens now in the state of North Carolina, Richmond County, they're all offering appointments for the COVID vaccine. And I think that over time, where we have vaccinated 70% of all the vaccines given to Amazonians, that percentage may drop as additional vaccinators come online. Some people, for example, have been holding out to get the Johnson & Johnson single-dose vaccine so they don't have to get 2 shots. I've been asked, why aren't we getting the single-dose vaccine allocated to us? Right now, the state's position is they're going to use that single-dose vaccine for large community events where they draw people from a large geographic region, and it's hard to get them back a month later, so you only have to get one shot. They're also using the single-dose Johnson & Johnson vaccine for places like correctional facilities, homeless shelters, migrant farm workers. And so I think we will continue to be allocated the Moderna vaccine. Just as an aside, relative to the farm workers, we have started working with our local migrant farm workers, and we had about 18 of them today, and we're scheduling them as we go along. So that's good news.
Dr. Thompson, is it true that the Johnson & Johnson vaccine is just a tiny bit less reliable than Pfizer and Moderna?
I have some experts here, but I think the general answer is, according to Dr. Fauci, all 3 vaccines are safe and effective.
Well, I don't
right?
mean that.
And there's a question of like 86% effective versus 95% effective.
That's what I'm talking about.
Yeah. And I think you're right. But what they tell us is that the Johnson & Johnson vaccine is 95 to 100% effective against you getting severe illness, having to be hospitalized, or death. And so the CDC says you can't just look at how effective is it in keeping you from getting, you need to look at how effective is it to keep you from dying, from being hospitalized, and getting severely sick. So, that's in a nutshell, where we're at. I will tell you, relative to other providers, you may know that in March, Carolina's healthcare system, February 26th, February 24th, they brought their mobile unit. I still call it Carolina's healthcare system. Atrium Health brought their mobile unit to Morven. Came back a month later, March 24th, got the second dose. March 26th, they came back to the Burnsville community. Commissioner Brickman was instrumental in getting that set up and doing a lot of the logistical work with Atrium Health, and they'll be back in a few weeks for the second dose at the Burnsville Fire Department up there. Also, I'm really happy to say that 2 weeks ago, the Anson Regional Medical Services received its initial 100 doses of the vaccine, and according to the online COVID vaccine management system, they have started to do some limited vaccinations. I think probably of their own patients at this point, but you know, every vaccination helps and moves us in that direction. Before we open up for questions, I'll just share with you some of the questions that the health director is getting. When will we know the pandemic is over? When will the state of emergency be lifted? How long are we going to have to wear masks? Should we be worried about a fourth surge with the so-called variants, the UK variant, the South Africa variant, the double mutation variant from California? And for the most part, my answer is I don't know. The health directors have not, and I think it's probably being debated nationally. What numbers do we have to reach for what period of time before the state of emergency is lifted? The latest I've heard from Dr. Fauci is we'll be wearing masks till around Thanksgiving or Christmas. Beyond that, I don't know. Everything that the CDC has put out so far is that the 3 vaccines are effective against the variants, and so I think that's a very good thing. We could talk more, but I know you have other people to waiting, and so let me stop and ask questions.
Yes, Dr. Thompson, you mentioned variants. Are there any cases involving variants in Anson County yet?
We haven't been notified of any.
Okay.
We have not.
Thank you.
The question I've been asked, Dr. Thompson, is how long does the shot last? Will we have to take a booster?
That's another good question. At this point, we haven't really been given any guidance. My honest opinion is it maybe turn into like a yearly shot, kind of like the flu shot, but that's just me. For sure, CDC guidance says 3 months at this point. I think they'll start upping that as they do more testing to see how people, when they draw their blood and see if their antibodies are still there. So.
Mine isn't a question. I just commend you ladies. I thank you. Yvonne, anything you want from me, I promise you. I have texted her, and I can say it in public, 8:30, 9 o'clock at night, and Lisa and you too. And these ladies have really, if they cursing, they don't curse on my phone. So I know where they live at, okay? But they have really, Dr. Thompson, Dr. Thompson, look at me, they have really did an excellent job. You guys have truly came through for Anson County.
Thank you.
It's important, we appreciate that. I wanna make sure, we would not be as effective with the vaccinations as we have been without the support of Rodney Diggs and the whole, emergency management team. And we're very, very fortunate, Yvonne and Rodney, we're very fortunate. That's not the case in every county, I can tell you that. So, our drive-throughs out there at EMS have worked really well. But I agree with you, Commissioner Sturtevant, 100%.
You did an excellent job.
Thank you all so much.
Thank you all. Once
Thank
again,
you.
we appreciate everything you're doing, and, as well as everyone else that's working with you.
Yeah.
Thank you for a great job.
Thank you.
Great job.
Okay, that brings us down to item 4B, Mrs. Swit, Sand Hills Mental Health Center, and that's on page 30.
Good evening.
Evening.
It's a pleasure to be here. I was not able to do any of the county commission meetings last spring. I always make my rounds in April and May and was not able to do that, so it's a real pleasure to be here tonight. Also, unfortunately, last April, as many of you know, we had to cancel our community breakfast, which is always a very good time and good food. So we're hoping that we can get that started back soon. So thank you once again for allowing me to be here tonight. I'm Victoria Witt. I'm the CEO of Sand Hill Center. And as most of you know, one of my reasons for being here tonight is to present to you the Sand Hill Center request for county general funding. I want to start off by thanking you once again for appointing former Commissioner Ross Streeter to continue his work on the Sand Hill Center Board. As I'm sure you know, his term limit will end in September, and I think it was a very wise decision on your part to have him continue the term limit on the Sand Hill Center Board. I will remind you in September, we will be coming back to your county manager for a recommendation of another county commissioner to take his place. The other Sand Hill Center board representative from Anson County is Priscilla Little. So you are well represented by Ross and Priscilla. You have in your packet our request. Our board met on March the 9th, and for the 17th year in a row made the decision not to ask for any additional funding from any of our counties. As you're aware, we have 9 counties, so we are making the request to each county for the same amount we requested last year, and that amount is $55,000. That money stays here in Anson County and goes to the support of the Daymart facility over on Old Lylesville Road. So we do hope you'll see fit to continue that funding. So that's the formal official reason for me being here. But I also want to take just a few minutes to talk about some new initiatives and to brag on Anson County and also Sand Hill Center a little bit about some new programs we're doing. I've had the pleasure over the past few months to get to know School Superintendent McLean and his staff. And he and I have been working on a proposal from the Anson County school system, something we're doing in other counties, I might add, to provide funding for the hiring of counselors in the school system. I think COVID has highlighted for all of us the need for kids at the school level to address behavioral health issues. So as of last week, we were able to work out an agreement where Sand Hill Center, I believe it was effective April 1st, will provide funding to recruit 2 counselors to be used by the school the way they see fit, and what they're calling a parent liaison. We provide the funding, we provide it through your county, and then it's up to you to work with the school to make sure the funding gets to them. Can't tell you what a pleasure it was to work with the folks that he assigned to this task. We've also had a very good relationship with your sheriff. We provide funding in the detention center for a company called Correctional Behavioral Health to provide video conferencing to the detention center. We have done that for years, and that has worked out real well. And recently, we were able to provide funding to Daymart, so they have a person who I believe it had been telephonically, but I believe they have actually started going to the jails now, or to the detention center. So good relationships there. Cannot say enough about the school system and about the sheriff's department. I would also say we've worked with DSS to some extent, and we are always looking for ways we can work with the community with the limited funding we have to address behavioral health needs. In your packet, you have what we call our dashboard. We usually go over this at the breakfasts. I think the first thing you'll notice in this one, as in all 9 counties, COVID has caused a decrease in the number of people going in and seeking treatment. But what this dashboard shows is the number of folks who are served in Anson County. It shows the providers. You can see there are 140 providers who provide some type of behavioral health service in Anson County. 18 of those providers are located here in the county. And then you can see that from a Medicaid perspective and a state dollars perspective, about $8.7 million a year are utilized for the services of behavioral health needs in Anson County. So this is just a quick dashboard of the services being received. Also want to highlight the CIT program. CIT, for those who don't know, stands for Crisis Intervention Team. It is a 40-hour a week curriculum for first responders. We always start with law enforcement, but we also do any first responders. We got this started a couple of years ago with the help of Lieutenant Stephen Kelly with the police department, the Wadesboro Police Department. We were going to have our 3rd class in May, but that had to be canceled because of COVID. However, we are on schedule for the next CIT class to be August 23rd through 27th. And if you've not been to one of these, I know most people can't devote 40 hours to be there, but it's fascinating to set in on some of the classes, attend the graduation, because basically what happens is that these guys and girls, once they go through the training, are considered CIT trained, have the badge that says CIT on it, and are able to better deal with folks with behavioral health crises. So I would invite county commissioners, if you want to set in, we provide breakfast, we provide lunch. If nothing else, come for a breakfast and lunch and participate in that. We, across Sand Hill Center, have trained over 1,000 law enforcement folks, and here in Anson County, we have trained 14. So the next class will be in August. And appreciate Lieutenant Stephen Kelly for his work as the host officer. Would also, in your packet, we have talked for quite a while about a new facility that Sand Hills is building or has renovated that will be a 24/7 facility, which is an alternative to the hospital, to the psychiatric units, and to the emergency rooms. I'm here to tell you, after 3 long years of telling you it's coming soon, the one in Asheboro is open now. This is available to all 9 counties. It's located in Asheboro because that's the central location, but it is now open to all 9 counties. What these facilities are 24/7 screening facilities that have observation chairs and can hold a person for 23 hours for observation. Adjoining that service is a 16-bed inpatient unit that if the person's issue has not resolved in 23 hours, they can be admitted to the inpatient facility. The one in Asheboro is for adults. It is open now. Once again, we just opened last week, so there may be a few kinks to work out, but is open to Anson County. And the best way to access it would be through the Daymark Clinic over on Old Lylesville Road. The other exciting part of these facilities is they will have 24/7 sworn officers on duty so that the custody can be transferred over from law enforcement to the facility. We are doing these once again to help with the delays and the long waits in the emergency rooms. So adult, Asheboro. Now what's probably even more of interest to you is we're doing a facility similar to this in Rockingham. It has opened, the observation part opened yesterday, but the facility will be for children. It will be only the second one of its kind in North Carolina. So you will have access also to that facility for kids, I believe the ages are like 7 to 18. So the facility-based crisis part, which are the inpatient beds, are probably not going to be online until June. But both of these facilities are close, if not already open. We are already giving tours to folks that if anybody's interested in seeing the facility before it gets cranked up, we would love to have you come down and take a look at the facilities. Once again, these are open to all 9 counties. The other thing I have included in your packet is our annual report. I'm not going to go over this in any detail, but this is our annual report. And then I also included some information about Medicaid. We have been talking about Medicaid changing now since 2015. Well, it's actually going to happen July 1st of this year. And this is the situation where Medicaid will be managed by private companies in addition to Sand Hill Center, but will also have private companies that will be managing the benefits of Medicaid recipients. So this is about the best thing I've seen come down because it's one page. Anything that's one page is always good. And it gives you kind of a quick and dirty of what it's all about. I'm sure your social services, DSS, and health departments have kept you updated on this, but this is very important to us because anything related to Medicaid affects behavioral health because Medicaid is the primary funder of behavioral health in North Carolina. So that's a lot of information I've thrown at you. I'll be glad to answer any questions you have about what I presented or anything else. Yes.
With the sheriff's office, it's limited in manpower. Would there ever be a time when those courses would be available in a evening class, or it's hard to probably allow a 40-hour deputy to be gone.
Right.
And it seems like a pretty important class. Would there ever be a longer time frame with shorter classes?
I'll tell you one thing we have done, and we've done it here in Anson County because many of you know Kay Ratliff, who kind of helped us put together kind of a mini CIT that was more like 2 days. And while the state doesn't like to do that, sometimes you have to, because in small communities, you can't free up deputies.
That's right.
So we understand that. So if you're interested, I can have our CIT people contact you, if you have a card or something, and we can see if we can work out some type of 2-day, something like that.
And I wouldn't wanna speak for the sheriff, but I feel like you'd have a better turnout if it was more accessible and the shorthandedness of it. I could talk to him and get back with you.
Okay, if you would, and you could contact me, and I can put you in touch with our CIT folks. We're really wanting to tailor it based on the community, and we have learned Montgomery County is the same way. Montgomery County has a lot of difficulty. And another thing, let me make sure you understand this. We offer these almost every month in some counties.
And the
so
sheriff is
what?
aware of this program.
Exactly.
He was with us. Yeah, he's aware of it.
Right. So what folks can do is send 1 or 2 to wherever the session is happening. That's how some counties do it too.
That sounds good.
But we're happy to work with you. It's a great program.
Sounds good.
Anyone else have any questions?
Good job.
I guess the managed care of Medicaid is, as I understand it, it's actually committed to happen this time. There's no budgeting issues, which has shut it down in times past, and there's no political issues and all that kind of stuff.
Well, you remember it got right up to the wire last July, and then the Governor Cooper drew the line that said no Medicaid expansion, no Medicaid reform. But no, it looks like it's going to happen. They say the governor's on board.
Okay. Okay, all right. Thank you, Ms. Williams.
Thank you.
We appreciate all you do, Fancy.
Thank you.
Okay, next is 4C. Mr. Coltrane, is he here?
No, we scheduled him to come back in May. We're looking at May.
Okay, Mrs. Parker, Central Line.
Also, she's not here, so I was gonna speak on behalf of the Central Line of Land Use Plan.
Okay.
As you know, for the last year and a half, we've been working with Central Line of COG to produce a updated version of our 2040 land use plan. There are several reasons for doing this plan, and several reasons for its adoption, hopefully tonight. And that's mainly to get toward a zoning ordinance that we want to move toward, because without having a zoning ordinance, it makes it very difficult for economic development to take place in Anson County. And based off General Statute 160B, without having a land use plan that's adopted, you cannot have a zoning ordinance. So this is the preliminary foundational piece to move toward the economic development tool. As you can see on page 57 of your pamphlet, this is the PowerPoint is a scaled down version of the presentation that was going to be given. In your packet, your envelope, there should have been, there is an entire 100 and some odd page land use plan. That is it in all this robustness. Again, a lot of good principles in it. I'll focus on some quick things real quickly.
I was really impressed with the group of people that were on the steering committee.
But all community members who all really wanted to see Anson County move in the right direction. So, again, we started in August of 2019, and we would have had this done 6 months, 9 months ago, if not for COVID-19. And that kind of put a lot of the community input sections into the background. But things I want to focus on real quickly are on your business statement. What the members of the community, not just the steering committee, saw as the business statement. This is on page 64. The business statement declares where Anson County wants to be in the future, framed in an aspirational, forward-thinking manner. It describes the intended future outcomes, decision-making, public policy, planning, and investments, and it connects and inspires stakeholders and residents about the future. So what was proposed, and hopefully will be adopted, is this business statement for Anson County. Anson Jackson will be a dynamic and inclusive county that will celebrate its rural heritage and is committed to creating a prosperous, livable community for all residents. And that seemed to be pretty inclusive. It seemed to be broad enough, but also had some detail in it that lets us know where we're going to be in the county in the next 20 years. And then going forward, on page 67, guiding principles. We talked a little bit about this on February 15th, I believe we did, at our budget retreat. And we wanted to focus this plan with what the budget's going to be able to hopefully fund coming up this next year. Again, you have 6 or 5: livability, economic growth, community growth, natural environment, and services. So in those things, those were broken down into more things: guiding principles, and then goals. Next page. And then there's several more breakdowns about how we can go through these action steps over the next 20 years to achieve these things, to achieve that vision. Again, if you have any questions about any of these, feel free to ask. We're here to answer those questions, but we wanted you to take a moment, look at it, ask questions, and then hopefully vote on it tonight to adopt it. We went to the planning board at the beginning of March, and they voted on it unanimously to support this land use plan. So with them having crossed that hurdle, the last piece is to have the BOC adopted.
I've already read of it, and I make a motion that we adopt it tonight.
Second.
Okay, we have a motion from Commissioner Sturtevant, seconded by Commissioner Sims, to adopt the Anson County 2040 Comprehensive Land Use Plan. Is there any discussion? Anybody else have any questions? So, I will say this is, it's a very detailed plan, and the 116-page document, there's really some eye-opening data and information in there about Anson County. And the PowerPoint presentation ties right directly into that, so very good, very, very well thought out. I guess I'm a little bit prejudiced since I was on the committee.
You notice I said there's some good people on the committee.
Okay, hearing none, all in favor, let it be known by saying aye.
Aye.
Opposers, like sign. Okay, hearing none, it is approved unanimously. Thank you.
All right, thank you all.
Okay. That brings us down to 5 appointments. The Acts Advisory Board, that's on page 78. And actually what's happening there is there was a commissioner serving on this board up until December, and we ought to replace that commissioner on the Acts Advisory Board, as I understand it. Is there a recommendation or a volunteer?
Hearing none, I'll volunteer.
Okay, all right, Commissioner Gable has volunteered. That information will be passed along to County Manager. Okay, next one is on the next page, and that's to reappoint Frank Richardson to another 3-year term on the ABC board.
Well, Frank's my buddy. I make a motion he be approved.
Second.
Okay, we have a motion by Commissioner Sims and Commissioner Sturtevant, seconded by Commissioner Gable, to reappoint Frank Richardson for another 3-year term on the ABC board. All in favor, let me know by saying aye.
Aye.
Opposed, like sign. Hearing none, motion passes unanimously. Okay, item 6, the manager's report.
We have the audit status, and to present that is the interim finance director, Amber Daniels.
Good evening. Oh, this is weird. Okay. It's okay. Sorry, y'all. Gotta get used to talking up here. Not here to deliver the news that y'all would like to hear. The audit is complete. Unfortunately, we have about 3 or 4 more items left on there we're trying to get cleared up right now, and my goals is to have that for y'all in May to be completed by the time we meet next month. So, I know Kerry said that he would have it done before he left, but we ran into some balancing issues, last minute couple of items that were needed, and we're just trying to follow up and make sure that we give the auditors everything
efficiently and not halfway, so they don't have to come back and ask a whole lot of questions, which in return would be us having to do more work and just dragging the process out. So we're just trying to focus in and make sure that we get everything to them correctly the first time around.
And I can appreciate that. I guess the only question I would ask is, based on your involvement with it, is that a good projection? Because we've had 3 or 4 already to have it done by May.
Yes, sir. I followed up with the auditors yesterday just so I could have facts to speak to tonight. There are 3 key items that is going to require a little detail to get done, and then there's one more that's just scanning some information into them. So I feel confident to say that by the time we meet next month that the audit will be taken care of. Under my leadership, that's something that I'm putting a lot of focus towards to make sure it gets done. And in the process, I'm also trying to get a structured plan together so that next year we're not having the same conversation come April, come May. So I do apologize for the delay, but I'm doing my best efforts to make sure that it's corrected come May.
Thank you, ma'am. Some of the comments you made, you were reading my mind, so.
Yes, sir.
Thank you.
You're welcome. Any more questions or concerns?
We'll see you next month.
See you next month. Yes, sir. Thank you.
Okay.
Okay, next, employees of the quarter. Again, we launched this program in the middle of the pandemic, just try to boost morale, and unfortunately, we've not been able to bring the employees in to receive their recognition. However, they have received on the back end their recognition, extra hours of paid time. One day will be a lunch with the manager whenever we get around to having lunch again, or breakfast, I think it was. But we're trying to keep this as a cultural norm to remember that our employees are doing some really good work out there. And so we have 3 employees this quarter, and I just want to give them a little bit of a shout out. First, Bethany Livingston, for superior performance in enhancing morale of library staff by encouraging a positive work environment. Danny Starnes, for initiative in superior job performance by implementing additional options to promote the safety of ACT staff and the citizens we serve. And finally, Diane Timmons, for superior job performance during the office reopening to the public and taking the initiative to train new employee when the department was short-staffed. And I'll just, in my opinion, what's gone on in the tax department over the last 4 months has been a big strain, and any work that we receive from anyone down there has been a yeoman's effort. So Diane has done a great job while she's been down there, as well as the other 2 employees. So we'll get these to them, and we'll promptly look for the next employees of the quarter as well. And that's all I have.
How do you determine who the employee of the quarter is?
Each department head has a selection. They have a form, a sheet that they fill in.
You told me that.
Yeah, and then we have a metric can be voted.
Oh, okay, okay, you did say that. I know some ought to been received one.
Well, it's new. We're gonna keep trying to push it.
Suppose they don't get along with their supervisor and they don't never put their name on there.
Well, they can be recommended by other employees as well. It's not just an employee from the department head. If I recognize you as having done an outstanding job and no one else has paid attention, I can nominate you as being, because I recognize you, I see you. So it's open to anyone, but it seems like traditionally right now it's going through department heads.
Oh, okay. Thank you, Mr. Monroe.
No problem. That's all I have.
Okay.
Yes, sir.
Monroe. Okay, as far as the chairman's report, attended the Rocky River RPO meeting last month, and basically the 2 things that were reported on, we got a history and information on how roundabouts are determined, where to put them, and when they do that. And the other thing, we got an update on the volume of traffic that's on the Monroe Expressway, and this was done by Mr. Warren Cooksey. And so hopefully sometime in the near future, when they've got more information on the Waysboro bypass, we'll have them come down and do a presentation on that. presentation by the students. Masks are required. It will be set up so it will be social distance, and it's not mandatory to be there in person. And it's good you can come in person and just see what's going on. I think we'll also have a virtual access to it as well, I believe. With more information will be coming on that when we get the actual invitation. The other thing I would just mention, for those that's interested, just go on the UNC School of Government website, and they have some very interesting courses. I've signed up for about 3 of them. One of them is financial responsibilities for local elected officials, employment law for local elected officials, and social media for local elected officials. Just pay attention to it. If it says top 10 primaries free, I got caught on when I was signing up for it. When I got to the end, it popped up a bill. So I had to back out of that one. I wouldn't do anything like that before talking to Mr. Monroe and clerk of the board, make sure the money's available. And the last thing also this morning, the Department of Revenue, the Secretary of Revenue, Mr. Ronald Penny, made a presentation on extra credit grant program, and that was pretty interesting. It's a program where it was put in place for the pandemic for parents of students that very low income that are really struggling, and there's $335 out there for them if they apply for it. So I'm trying to get the word out on that, and I'll tell you what, I'll have Ms. Cannon forward the information to each of you so you can get contact people in your community, or if you know someone that can take this on. And there's a video that gives you the ins and outs of it. And the one thing about it is, if it's and it's really low income, but the individual, in order to qualify, they must have a child in school. Okay, that takes care of me. That's all I have.
Chairman, we can go back to 5A and appoint, like Commissioner Gatewood to that board.
Oh, appointed? Okay.
Please.
Okay, we'll need a motion to appoint Commissioner Gatewood to the Acts Advisory Board. He volunteered, but we have to officially appoint him.
Second.
Motion by Commissioner Sims, seconded by Commissioner Mims, to appoint Commissioner Gatewood to the Acts Advisory Board. All in favor, let it be known by saying aye.
Aye.
Aye. Opposed, like sign. Okay, hearing none, it's unanimous. Thank you, Ms. Campbell. Appreciate that. Okay, we're down to item 8, Commissioner concerns, petitions, announcement, and comments. 8A, EMS unit in Morgan. Mr. Monroe, can you speak to that?
Yep, unfortunately, we haven't got enough information yet, and a big chunk of that has been the vaccine efforts that we've been putting forth with EMS going to help with public health. However, we're looking at having a way to have that ambulance be there part-times, and we're going to try to move it to a full-time thing, because that seems to be the goal that people want down in Morgan. So that's the goal. Right now, I can say that we are working toward that, and I'll try to have something to you regarding that at our next meeting. At the minimum next meeting, we want to also have a budget discussion, and that might be a time I can give you some more information in the next 2 weeks. But we're moving toward wanting to put that back down that way.
Okay.
I had a question. I know we won't want to compete with EMS availability, but if we're on the other end of the county, is that going to have a negative effect on us when the unit is down there?
The other end of the county,
Burnsville is going to be 18 miles away versus Waitsboro being a central location from a unit that's going to be placed down in Morven. Is that?
There would be impacts, yes. But Burnsville also has a rescue squad in that area, if I remember correctly, that we pay $10,000 to annually. That means they have resources. There's not a rescue squad in Morven.
Okay.
There's not a rescue squad in Morven. So this way you kind of balance out that availability of service.
Okay.
Yeah. But yes, whenever you move a ambulance from one spot to another, you're going to have a delay, and that's just what would happen. So.
Okay. All right. Thank you, Mr. Monroe.
No problem. The next I think I had on here was trash and litter.
Trash and litter, that will be yours for your sir.
Okay. I had a call from a lady in the Peachland area about trash and litter. Some of you may remember that is one of my favorite topics. Not long ago, I came up with the idea of a $500 fine or 30 days in jail for somebody throwing out trash and littering in Anson County. We do have a great problem, and we have it all over the county. And black people, white people, Asian people, all of the majority of Anson County are good people. They don't distribute trash, and they don't want others to do it. And we need to do something about it. I had another idea. I have all kind of crazy ideas sometimes, but you don't know till you hit on one. I'll ask Mr. Forbes. My understanding was that the reason we couldn't do the $500 fine and put somebody in jail for 30 days is we couldn't always determine who was driving the car, who was the person doing it. I remember Charlotte had the same trouble with stoplights. So I had another idea. Let the people of Anson County, those that will, and I believe there are many, they see somebody throwing and dumping trash, take the title, the license title down, license plate, and if they know or can describe the car and the make, and tell us about it. And why couldn't we confine the car for 30 days? We'll know the car, and we'll know the license number. Why couldn't we take that car into custody for 30 days?
There's mechanisms by which you can identify someone who litters, and if you were to identify that person, or someone were to see that act, come to the magistrate's office, file paperwork, then that person, if they could identify the person, then and knew their name, that person could be arrested. To take someone's car, when you see it identified like that, you probably have to be better off catching them in the act to do it. I'll be glad to research the details on that. I'm concerned with actually catching someone doing something, just merely my neighbor did this and I saw them dump the trash, therefore y'all come take their car for 30 days. There would have to be some mechanism in there in which you could positively identify the people. You have to reach to a probable cause area. But I'll be very frank with you, I hate a litter bug as well, so I applaud your efforts.
Well, now I thought about a mechanism. Why couldn't we have some of these cameras based in a high spot where they couldn't be reached or torn up and pretty secretive, and actually photograph what's happening? How would that be?
I would say if you could identify with the camera, if you could sufficiently identify the person and identify the vehicle, you could have that person arrested for littering. Yes, sir.
We've got to do something, Mr. Forbes, because it's just out of hand. We're probably one of the most, I hate to use the word, trashy county right now in the state of North Carolina. My wife and I, sometimes we go around for rides for entertainment throughout the county, and I see it everywhere. And sometimes I see places where people have dropped a whole truckload off. Now, I don't know if these people understand, but you can go to any of our local landfills and leave all that stuff, and it doesn't cost anything. It's completely free. You just pull up to the bin and dump it into the bin. Seems like it would be easier to do that and find a secluded spot down in a hole and dump it there. That's just my opinion, which sometimes isn't always right. I think it really, we've talked about it, we need to find a way to do something about it. We look bad, and I believe we're good people, and I believe people don't want it. I believe black people don't want it, white people don't want it, Asian people don't want it, and those few people that don't care and are willing to denigrate the county, something needs to be done to stop it.
Commissioner Sims, I'll be glad to discuss this matter with you more. I'm sure there's some venues in which surveillance mechanisms or surveillance cameras have been used to stop break-ins and things of that nature. I'm sure it'd be the same way with littering and all that. I'd be more than happy to discuss it with you sometime and, maybe even present, some proposals to you.
Okay.
Yes, sir.
These things are very accurate, the way I understand it from some of the friends that deer hunt and so forth.
Yes, sir.
Yeah, I think that's.
Thank you.
That's a very valid point, and I was looking, after you mentioned it, thought about the same. Matter of fact, I was kinda entertaining myself, and then when I know some people at deer hunting, I was talking to them about it, and that's the biggest issue they got, is people stealing the cameras. But, like you said, and this is something that came up too, and the county manager kinda check into it, we may be able to work with some of the utilities, somebody like PD Electric somewhere, and they can maybe put it up on the pole.
Right, that's what I was
Everybody can
thinking
get to
too.
it.
It would require something like that, because, anything that is within this, one of the things that we have an issue with, and, we see a lot of street signs being taken, and because they might have your name on it, you see Gatewood Lane, so they want to take that, and if you want to have a camera out there, if it's seen.
They can see it, they would take
they're
it
gonna
and
take it.
destroy it, I understand.
And so you wanna make sure that there's, in a location that's
Right,
removed.
safe
and-
location.
Yeah, and identifying those places is gonna be something we need to work on if we're gonna go down that route.
And, perhaps, the team that's, how many people on each group do we have out picking up, trash?
Well, when the company comes, they have a truckload, used to have either 3 or 4 people, I believe, to clean up. And then we do it by mile stretch. We give them, maybe a 12-mile stretch or 10-mile stretch, and they go out and clean. That's part of the, not 10 or 12. Usually it's between 1 to 2 mile stretches at any given point.
I see some places where they've done a good job, but it would take an army battalion to clean up Anson County.
Well, the thing is, when it's clean, it becomes available to be dumped on again.
That's right, that's
So-
exactly right. I've seen some places you've cleaned up, I come back by in a couple of weeks and I say, what?
Okay, like I said, I think maybe that might be something that, we could work towards in that part, and also in Mr. Monroe's report, this week or last week, there were some things he was discussing with, the landfill administrator about litter. I don't know if you, at this point, you have anything to report on that or not, but I think he's actually working on trying to do something about it.
Yes, well, one of the things we're gonna start researching, in last month when we talked about it, one of the things that those surrounding counties had, and not only additional convenience sites, days at the convenience sites, they also have a litter issue. That's also something that's consistent across the board, not just Anson County, but there's also a litter officer that these places were having. And my thing is, I want to do some research to understand exactly what the efficacy of that position is. If they're still having a litter problem and they have this position, is that really what's needed to prevent people from littering? At the end of the day, this is gonna be a real heart problem. People need to feel like they take care of their house and they won't dump in it. It's gonna require us to do a lot of effort economically, expense-wise is what I mean, to make sure that people don't do it and get punitive. And I don't know if we have the resources for that.
Right.
At the end of the day.
One quick item, and I wanna add to that, it's a health issue, it ends up in our drains, our ditches, our culverts, our creek banks. It's an eyesore, it affects us economically. There's so many negative impacts to this that we ought to really look at it. Finished.
Okay.
And now let's go segue right into the landfill
Yes.
convenience site, I think it was.
Go right ahead.
So it was in last week's, communication, talked with the landfill supervisor, and the convenience site, he's willing to obviously work with us and try to open one of those things up as early as, say, June of 2021. However, in that instance, going along with Commissioner Sims' point of view, he would like to see the county be able to partner with Waste Connections in some shape or form to provide some type of additional coverage of litter. And so that's where the litter officer was discussed, that's where the convenience sites were discussed, that's where there's a couple other things that we're talking about. But he felt that he had no problem doing it from his end, but wanted the county to also contribute something to it as well.
I see.
So,
Once you become punitive, it will stop.
Okay. All right, and then the, last item on the commission's concerns is, Mr. Monroe, this will be something for you as well. I think we're all aware that the The town of Wadesboro recently enacted an ordinance as far as gaming facilities are concerned. I think the county needs to follow suit, you know, check with other counties that may have them, as well as look at what's in the Wadesboro ordinance that we could use as well, and get an ordinance together that, Anson County can put together as well, because what's gonna happen if, say, the town of Wadesboro's got one, that's just gonna run them out into the county.
Right to the county.
That's exactly right.
Okay, I'll work with that.
Okay.
One of my concern, what would the update be on the possibility of 3 days a week at those convenience sites? Cause I think that was a little bit more specific that I was wanting to get an update on.
Yeah, in the report that I wrote last week, the increased number of convenience site days to include Saturday. Regarding the third option, the Waste Connection supervisor mentioned that the third day, Saturday, can be added as early as June 2021.
Okay, so it'd be Tuesday, Thursday, and Saturday if it goes through?
That's what was the board as I understood it. That's what it was 10 years ago when it was
That's
sold.
right, exactly
So-
right. Okay,
So-
good. Yes, sir, thank you.
Okay. All right, okay, that brings us down now to, item 9. We actually have a couple of closed sessions. 9A is to consult with the attorney on the North Carolina General Statute 143-318.11, parentheses A, parentheses 3, and then item B, personnel, North Carolina General Statute 143-318.11 A6. So this time we need a motion to, go into, closed session.
So moved.
Second.
Okay, motion by Commissioner Gatewood, second by Commissioner Mims to go into closed session. All in favor, let me know by saying aye. All in favor, let me know by saying aye.
Good to see everybody.
Hi.
Aye.
All opposed? Okay, motion carries unanimously. We are now back in open session. The only thing, to announce in open session is that, I hate to say this, I'm not gonna say it. The county manager has resigned effective June the 4th. I ain't gonna say we accept it.
Jordan, I love you.
Okay,
Vietnam.
motion to, let's see, what do we,
We can adjourn.
motion to adjourn.
I second it.
Okay, motion from Commissioner Gates, seconded by Commissioner Sturtevant to adjourn. All in favor, let me know by saying aye.
Aye.
Opposed, like sign. Motion carries unanimously. We are adjourned. Thank you all.
All right, thank you.
Good meeting.